The news day continues here on One News Now. I'm Charles Lejano. The Health Department warns that it is possible for active COVID-19 cases in the country to reach over 400,000 by the end of April if the government will not impose stricter measures. Greg Gregorio joins us live from Mandaluyong to tell us more about this. Greg, with this statement, are we looking at the situation wherein ECQ will be extended after this week? What are we looking at here?
Charles, according to the Department of Health, they are not disregarding the possibility of either extending or lifting the current implementation of enhanced community quarantine over NCR and other neighboring areas. Health Undersecretary Maria Rosario Vergara said the government will be basing their decision to some indicators, and this include the lower hospital care utilization rate over the National Capital Region as well as over the whole country. Charles?
Right, Greg, talking about the healthcare system, how is it holding up as of today? Do we still have enough hospital beds, ICU beds to service patients?
Charles, according to Undersecretary Vergere, the hospital care utilization rate for the whole country is at around 63%, while it is 73% for the National Capital Region. And Vergere admitted that we are choking when it comes to the utilization of ICU beds, especially in the high-risk areas. Thus, the government is targeting to lower the hospital care utilization rate by after a week of these enhanced community quarantine. Charles?
Yeah, Greg, so what exactly is causing this choking, and how's the government planning to address this lack of beds and medical personnel for COVID patients?
Plus, according to the Department of Health, when they have audited the hospitals, they've seen that 41% of the admitted patients for COVID-19 are asymptomatic and mild cases. And Vergara said that these patients should only be admitted in step-down care facilities like the temporary treatment and monitoring facilities. Thus, the government is also building additional beds, which they say will be available by April 8th. And as to the question on the lack of medical workers in healthcare facilities, Vergere said that there are measures in place to augment the medical workforce in facilities, and this include the continuous hiring of medical workers and tapping the uniformed personnel of the Armed Forces of the Philippines for their medical offices, for their medical officials to augment the medical workforce in facilities. Charles?
Right. How about the government's vaccination program, Greg? Do we have any significant updates as of today?
Plus, according to Vergere, 80% of the distributed supply of the vaccines that we currently have, that is around 1.1 million doses of COVID-19 vaccines, 80% have been inoculated already. But the Department of Health is now calling for all medical workers, even those that are not directly giving care to COVID-19 patients, including those under other medical societies like the Dental Society, for them to have themselves registered for the inoculation until March 31. And while doing this, the department is now planning to do a simultaneous vaccination for the senior citizens and people with comorbidities. Charles?
Right, talking about comorbidities for a bit, one of the things to look out for as we anxiously await these vaccines to come our way would be these certain illnesses that would classify as comorbidities for purposes of either being qualified for a certain kind of vaccine or being disqualified altogether. Could you tell us more about this?
Because according to the presentation of Dr. John Wong, the member of the DOH Technical Advisory Group, there are currently 7 comorbidities that they are eyeing to give. There are 7 comorbidities that they are prioritizing to be vaccinated. These are individuals with chronic respiratory disease, hypertension, cardiovascular disease, chronic kidney disease, malignancy, diabetes mellitus, and obesity. And they are also including the chronic liver disease, although there are still a small number of evidence that chronic liver disease also causes a higher chance of severe infection. According to the DOH, they are estimating around 14 million Filipinos that are having comorbidity, and thus they are prioritizing these individuals with the diseases that we have mentioned. Charles?
All right, that is great to hear. But then let's talk about these additional vaccines that we're expecting to come in. Greg, what's new?
Charles, the earliest additional COVID-19 vaccine that we are expecting is the 1 billion Sinovac COVID-19 vaccine. So we're expecting to arrive by late this afternoon. According to the vaccine cluster of the government, it is part of the government procurement as compared to those which we have received earlier, which are mostly donations from Chinese government and the COVAX facility of the World Health Organization. Now, mentioning the WHO's COVAX facility, Vergeres said that the more than 100,000 doses of AstraZeneca vaccines that we are also expecting as an addition to the provision of the COVAX facility, we will be expecting this by either April or May. Charles?
All right, thanks for that, Greg. That was Greg Gregorio reporting live from Mandaluyong. Local executives are given the authority to decide whether they will require quarantine passes within their areas. That's according to Interior Undersecretary Jonathan Malaya during today's Laging Handa briefing. Malaya advises the public to inquire with their respective LGUs to find out whether quarantine passes need to be used when going out. The official also encouraged local chiefs to provide aid to their constituents, especially for areas under ECQ. Meanwhile, in an interview with Radyo 5, PNP spokesperson Brandy Osana disclosed that they have deployed over 9,300 officers all over the NCRP bubble. Although Osana assures the public that the assigned policemen will not use violence against those guilty of quarantine violations.
Kung sa pakikipag-usap na lang pong ito, ay pwede na lang po silang makapag-comply strictly ng adherence sa minimum health and safety standards. Palagay ko hindi naman po ngayon magkakaroon ng problema ang ating mga kapulisan. However, we also need to consider may mga LGUs po talaga na may mga kanya-kanya pong mga ordinances na up to now posibleng mag-create din ng problema sa ating mga mamayan, lalong-lalo na kapag ang pagmumulta ang magiging basihan para sila'y masanksyon. Ang multa po kasi isang pamamaraan para matuto din ang mga mamayan dahil magbabayad ka po sa gobyerno. Pero ang layunin po dito talaga, yung mensahe na kailangang ipaabot, kung kayo o mga mamayan natin o tayo lahat ay maaring sadyang nagko-comply ng mga ganitong requirements, palagay ko hindi naman masama na sa panuntunan ng gobyerno ngayon, and we're imposing a one-week ECQ again, baka sa pagsasakripisyo ng ating mamamayan, stay na lang po sa kanilang mga pamamahay, lalo-lalo na yung mga non-essential travels, at makababa ang bilang ng mga infection dito po sa COVID-19, palagay ko tayo na rin po makikinabang pagdating po ng after 1 week.
The Philippine College of Physicians believes the 1-week enhanced community quarantine in NCR Plus areas is just a temporary intervention. On One News's agenda, PCP Vice President Dr. Maricar Limpin said medical workers welcomed the government's move to put high-risk areas in Mega Manila under ECQ as hospitals reach critical levels. However, Limpin says this only serves as a temporary solution, especially if the public continues to disobey health protocols and if the national government, LGUs, and the business community fail to consistently enforce anti-COVID measures. Limpin adds that long-term solutions include uniform requirements for travel among local governments and enhanced contact tracing.
So after 1 week, balik na naman tayo sa dati. So magiging baliwala itong 1 week na ECQ na ito. So ang pinaka-importante dito ay ilagay natin yung mas medyo long-term na intervention na talagang magiging significant ang pag-contain ng pandemic. At dito nakasalalay yung adherence at saka yung pagpapatupad ng mga LGUs. Kasi Sito, iba-iba ang requirement natin eh.
The Labor Department says they're continuously providing assistance to employees affected by the current lockdown. Speaking with Cito Beltran on One News's agenda, Labor Secretary Bebot Bello explained that employers may submit names of displaced workers for them to receive aid. Although Bello adds that employees can also apply for assistance on their own through remittance centers. On the other hand, the Secretary also defended their decision to impose a cap on the number of nurses being sent abroad. Bello argued that our country needs more nurses, considering the current COVID-19 situation. That's despite admitting that Filipino nurses may receive better pay overseas.
As far as pay is concerned, totoo naman na mas mataas ang pay ng mga nurses and healthcare workers in the public sector. Pero merong pending bill, and this is authored, and we co-authored it, and it is authored principally by Congressman Pulong Verde. This bill proposes that the compensation and other benefits of all nurses and healthcare workers in the private sector will be elevated to the level of the healthcare workers in the public sector. Pending po yan sa Congress.
An assortment of hand sanitizers that came to market during the coronavirus pandemic has been found to contain high levels of a chemical known to cause cancer. Bloomberg's Anna Edney reports on Quick Take Charge.
One of the key takeaways from this firm's analysis, which the firm is called Valisure, it's an online pharmacy that tests a lot of products that go through it, mostly drugs, but in this case, hand sanitizers. And sort of the takeaway was that these hand sanitizers it did find with high levels of benzene are ones that sort of jumped in to fill the gap when all of the household names that you know, like Purell or Suave, were in shortage. You know, nobody could find hand sanitizer for a long time when the pandemic began. Shelves were empty. And so these other firms sort of jumped in. They hadn't made hand sanitizer before. And so those are the ones that Valisure found were containing this contaminant, whereas the ones that we know, the names that we've used before, the Purells of the hand sanitizer world, those they found were safe and did not contain high levels of benzene.
So how do we know if we purchased one of these hand sanitizers? Is the list that is included in the article, is that exhaustive?
The one in the article is the list of the highest. So these are 15 brands. There were 21 total bottles out of that were the highest levels of benzene. And then there are another couple dozen that did contain some levels of benzene. And so those are ones that actually we link in the story as well to Valishure's citizen petition. This is something they filed with the Food and Drug Administration to say, here's what we found. We think that you should recall all of these and look more into this. And, you know, because Valisure couldn't test every hand sanitizer on the market, so maybe others need to be looked at for benzene as well. And so that citizen petition does have the full list in there too.
And those are the top stories of the hour. Join Riza Diaz later at 2 p.m. as we continue to monitor the day's biggest stories. Mask on, wash hands, and stay safe, Philippines. And most of all, stay negative, but be positive. Kaya natin to. I'm Charles Lejano. We are One News.